to pass on to someone. I wish there was a way that we could actually resell those microscopes, but I don't think there's a physical way that we can do that right now through the bookstore or anything. So, but the slides, the plastic slides, these little plastic slides, and the microscopes themselves, I think those are great little adventures for young scientists, right? To take a look at, pull a hair and look at it under the microscope, or pond water when it gets to be warmer again. Yeah, I know, but I don't think we have the capacity for that right now. So unfortunately, I think we're just kind of stuck with it. So chapter 18, thoughts, questions, worries, concerns about chapter 18. Yeah, it's non-returnable because you have to send them, you would have to send them all the way back to Carolina. So diseases of the skin and eye. Those look awesome. Speaker view, there we go. Okay, there, I'll minimize you guys. I forgot to put glasses on, so it's a little tricky, but I believe that I posted notes for that. True, false? I think there's notes for chapter 18 in the module. So I was going to call them up if they're not, so that you guys could see them, but I think they're in there. Lecture notes. Yeah, there's notes for chapter 18. And they are from they're from not that long ago. So they're from the last edition of the book, but it's pretty much the same order of things. So I'm going to open these notes and then give a screen share with you guys. So the test, I would have to look, Sarah, I'm going to have to look on our module for that, because I wrote all those dates out and then I didn't bring my calendar actually upstairs. So I was going to do that and I forgot. So I think that in the announcement, so I think I have the labs due on December 12th. So let's go to our course and take a look. I think there was an announcement that I put all those due dates in, right? I think it was this one. Oh, doesn't look like it. Let's try. Does anyone remember what the date was on that? Yeah, it might have been this one. No. Anyway, I think it was, I thought. Anybody, does anybody know? Because I can't seem to find it. That would be helpful. Sorry.
For the test date?
Yeah, there was, I had posted an announcement, I thought, all of the.
Yeah. It's on Wednesday, December 2nd.
Right, the test for chapter 18 is Wednesday, December, Wednesday the 2nd. And then I think the next test, what I wanted to tell you guys today was, we take a look at the modules. So we're kind of finished with module 5 now. So we have 6 and 7 to go. I just started posting things in module 7. It's underneath all the lab modules. It does look like there is a document for skin and eye, and the quiz.
It's in module 7.
Yeah, module 7. So I haven't posted the quiz yet. My plan was to just do a single chapter and have a quiz on each chapter. And I originally had said in that announcement that we would do chapters 18, 19, and 20. I think I'm going to rescind chapter 20. I think we're just going to cover 18 and 19. With the amount of lab that most people still have to do, as well as the lab quiz that last week, I think it might be better if we have less to do. So I'm thinking that module 7 is only going to contain work for chapters 18 and 19. These look like Connect work that I finally got loaded in there. And then I do have notes for chapter 18, and I believe I also have notes for 19. They need to be updated, and then I will post them. I would pay particular attention in chapter 18. There is a section about what the different types of skin eruptions are. So chapter 18, let's have a little chat about that. I'm going to stop sharing this screen with you, and where are all my controls here? All right, so I'm going to make this big again, and speaker here, and big. All right, so there's some more stuff in the chat that I need to, all right. We can, Lauren, but it's kind of, I'm doing it sort of as a one-on-one, because when I open them up for everyone to see, it also allows it for the students that actually haven't taken the quiz. They can actually see the answers as they're taking the quiz. So if you want to schedule a time with me that we can talk about that, if there's certain quizzes in particular that you want to go over and see the answers, we can go through that one by one, and I can show you your exact quiz. So yeah, really, there are people. So there's a lot of people still in this course, right? There's like 40 people. So there's people that were sick and had family deaths in their families and things that happen, and people who got COVID and all of that. So there are some that still haven't. And I have to try to give them as much opportunity as possible, because I don't want it to feel like that you didn't have a chance to complete the work for the semester. So there are some things that I wanted to talk about for, I wanted to talk with you about for chapter 18 to pay particular attention to. I did not intend to go through a whole lecture for chapter 18, but there is that note outline, and it's pretty extensive. And of course, there's the book, which the material comes from. So there, the chapter opens up with discussion of skin and the layers of the skin and normal microbiota of the skin. I would pay attention to the particular names of the bacteria that are normal microbiota, and that they are different than what we might suspect. And there's more of them than we would suspect. And then your textbook goes right into diseases caused by, pretty much they start with Staph aureus and then do some streptococcus. And they go by disease rather than organism. So myself, if I were you, that's up to you. You could either make flashcards that are organism-based or flashcards that are disease-based. What I mean by that is, for example, they start out with, they actually start out with MRSA, which is caused by Staph aureus that has a phage that produces the antibiotic resistance. And they go through that, and then they talk about impetigo, and impetigo can be caused by Staphylococcus aureus or Streptococcus pyogenes, usually depending on the age of the child, whether it's a newborn or a child, older child or adult. And then they go to cellulitis and give the bacteria that can cause that. And so the questions will probably be phrased in the same way, right? So you may be asked particular questions about how can you distinguish between cellulitis caused by Streptococcus or cellulitis that's caused by Pseudomonas. So I would pay particular attention to the characteristics of the disease. I'm not going to ask you the names of the specific drugs that treat the disease. However, you should be able to distinguish if it's a bacterial disease, and the answers, some of the answer choices are things like treatment with antibiotics, treatment with topical antibiotics, treatment with antiviral drugs, treatment with antifungal drugs. If it's a bacterial infection, you should be able to identify that it would need an antibiotic for bacteria, right? So there will be questions like that. Predominantly, they go through all the diseases caused by bacteria and then start the viral diseases. And then at the very end, they do a few fungal diseases caused ringworm and the various permutations of ringworm. It's named by where it happens on your body as far as sort of a common name, all caused by three main fungi. And most of the time, it's not even diagnosed as a particular fungus. It's usually just assumed based on the signs and symptoms. And then the treatment is obviously usually a topical antifungal drug. And then at the very end of the chapter, there are a few diseases caused by protists and cutaneous lesions. They throw in anthrax, which is a bacteria. So be careful. Generally, it's bacterial infections, viral infections, fungal infections, protozoan infections, but because they're going by the disease characteristics, like pustular lesions, they have a protist infection and a bacterial infection in that category. So just be mindful as you go through to identify, and they've done it in the tables in your book as well. They've put a circle with B for bacteria, V for virus, P for protist, right? So that kind of help you remember. Signs and symptoms, right? The major signs and symptoms and like distinguishing characteristics of the disease. Treatment, of course, prevention, if it's listed, particularly if it's a disease that we can vaccinate against, that would be considered prevention. And then most of the viral diseases, of course, do not have particular treatments, but supportive care. I would also point out to you, and I'm trying to flip through my textbook right now, don't forget about the disease of the eye. There are just a handful of them. Remember that always the pictures in the textbook for the clinical diseases are always going to be some of the worst pictures that have ever been documented, right? They often show us the worst case scenario. So when I look at this picture of impetigo, that's a huge part of a person's body that's covered with impetigo. Usually it's very small, like crease of the nose, maybe just a little bit of scaly skin, or on a child it might be above their eye. It's usually not quite as dramatic as the pictures in your book. There is on page, let's see, this looks like 504, there is a table, like an insight box, it's called Insight 18.2, and it lists all of the descriptions of sort of the pus-filled lesions caused by various forms of staph and strep, like, for example, folliculitis, a sty, what is a carbuncle, a furuncle, a macular rash, a papular rash. And then I think there's another place where they list the characteristics of the rashes. That's in a separate box, table 18.1, terms used in describing skin conditions and infections. And some of those cross over between bacteria and viruses, but most of them, like a wart, for example, is only used to describe a particular lesion that's caused by a papillomavirus. So I would take a look at that table with the definitions in it, and I would also pay particular attention to that insight box that listed the different sort of characteristics of, for example, a boil, which would normally call a carbuncle or a furuncle, and how that's different from a sty, how that's different from folliculitis or a pimple or a pustule. Because when you read about the diseases, that's how they're going to describe the signs and symptoms. They're going to just describe them straight out and just use a pustular rash or a macular rash, which means a flat redness with clear distinctive margins, or a different kind of rash. And so if you know that vocabulary ahead of time, or at least are a little bit familiar with it, when you read about the different diseases, then you can start to see some of the distinctions between the signs and symptoms. I would focus on what's in the blue boxes. That's a nice summary statement, pretty much name of the organism for a particular disease, the signs and symptoms, the transmission, Sometimes the reservoir is listed there. Sometimes the diagnostic test that's used is also listed, and then the treatment. So that's kind of what I would focus on for these disease chapters. I'm looking through the eye, and then at the very end of each chapter, there is a picture. The summaries are really good, and then there's a picture usually of a person, and you can, and then it lists all of the particular diseases and the areas that they affect. So that's usually a great place to look for a summary and make sure that you've gotten all the particular diseases from that chapter. So again, we're just going to cover 18 and 19 for this last quiz. We're going to do them one at a time. We're just going to do 18 this week and then 19 next week. And then you'll have your lab final and your lab report. And then that'll be the end for us. And I realize I still have to get that final formatted. Yeah. I still have to get the rest of that lab report formatted. And again, I put the circles in for you to draw what you see in the microscope, but I realize that it's probably not going to be a great drawing, or you're not going to be able to tell the difference between the bacteria, but that's okay, just that you've seen something. And then I just have the questions about stuff under the microscope and the tests, the biochemical tests to add, which I'm going to do my biochemical tests today. I've still been waiting for my bacteria to grow as well. And you guys know I started mine like 2 weeks ago. I still don't have any staph epidermidis on my Petri dish. So I'm just going to do the oxidase test and the catalase test without the staph. I'm just going to do it on the E. coli and the micrococcus because that's all I got to grow. I'm going to try it with the staph in the broth culture, but now it's getting really old. So I don't know if it'll be alive or not, but I am going to test the 2 that I have. And in the video for the triple sugar iron broth or triple sugar iron agar slants, the TSI slants, the pictures of the results in the lab book, in the Carolina lab manual, are better than the results that I got. I didn't get the E. coli. The E. coli should have made that black precipitate, and I didn't get that in mine yet, maybe today. So I would look at that for what's positive and negative. So when I ask that question on the lab quiz, what's a positive result for hydrogen sulfide production? You should be able to tell me it's a black precipitate. What's a positive result for acid and gas production? You should be able to tell me what that looks like based on the pictures that are in the lab guide that came with the Carolina lab kits. So those photographs are excellent. I would use those. All right, so that's all I have like logistically for us. Oh, sure, you can submit your extra credit anytime. It doesn't have to be by the 30th. You can submit that extra credit anytime you want between now and the end of the semester. So after you go to the giving page and you do a micro donation, if you just send me a screenshot or a picture of your receipt with the amount blacked out and any private information, like if you used a credit card to do it, obviously black out those numbers, and then I'll just award those 3 points. Most people will probably get them either, I'll probably just put them on the final exam and the last one. Yeah, because these 2 last tests I think are a little bit harder in that it's a lot of stuff quickly at the end. And yes, you can do it multiple times if you want, Lauren. So yes, absolutely. But I won't be able to, I won't be adding that in until like the very end, because I'll probably put those off until the last minute. I'll probably keep a running list and then I'll go back and look at, as I see them come in my inbox, I'll just write it down and then go back and add the points at the end. All righty, other questions, comments, worries, concerns? Yes, no. Yes, no. Okay, not Night University, no. Soon, probably. I'm not taking it as nagging. Yeah, probably in the next few days, because I'm pretty much finished with the live Zooms and doing any more outlines for you or for BIO1. Most of them are finished now. So I don't have a lot of other stuff that I need to do. And my current plan is after I grade 30 student submissions, I get to put up a Christmas ornament, Christmas decoration. So I'm using that as an incentive to actually start catching up on my grading. I'm not decorating this year. Yeah, it was so nice outside. I regret not putting up lights outside before it started to rain, but maybe it'll be nice later in the week. So yeah, that's my plan. So on Wednesday, we can talk about chapter 19. And then lab, if anyone's having lab troubles, it'd be great if you could either schedule to talk to me during our regular Zoom or a little bit before during office hours Wednesday or next Monday or next Wednesday, because I'll have time to we can just talk about the lab and your results. Some people are really struggling with getting their bread to mold. And for that bread mold, make sure it's in a warm place, make sure it's in a Ziploc bag that actually seals, and make sure you keep it wet. And you'll get mold, or you should. And try to use bread that's not like grocery store bread. Try to use bread that's fresh baked, like from like a piece of crusty Italian or French baguette bread, or a piece of a bagel maybe, rather than something from a plastic bag that has a lot of preservatives in it, because the whole point of the preservatives is to prevent the mold. We learned that in chapter 11, organic acids, right? All right, so I'm going to end the recording.